Hello, hello, everyone. Hello. We should be going live here from Nap Nap here any moment. We'll wait a few minutes just to let this get all settled in. Hi, everyone. We're going live from Nap Nap talking about Lyme disease. We'll let a few people sign in here. And while people are signing on, I'll introduce myself. My name is Ashley Jura. I am a nurse practitioner from infectious disease at Children's in Minnesota. And I am also the clinical advisor to the Nurse Practitioner Education and Knowledge Assessment for Lyme Disease Initiative with NAPNAP, and made possible by a cooperative agreement with the CC. I'm also a NAPNAP member and have been ever since I became a nurse practitioner about 8 or 9 years ago now. So glad to be here today, and I hope there are some good tips on here for the upcoming Lyme disease season. Our goal is we're going to talk about a few things regarding Lyme disease specifically, presentation for providers, as well as some ways that you can inform your patients to help avoid both tick bites and Lyme disease. May is Lyme Disease Awareness Month, which is why we're doing it now. This would be the beginning of the tick season, except we had such a warm winter. I don't know if I mentioned, but I'm in Minneapolis, Minnesota. We have plenty of Lyme disease here. So we had such a warm winter up here that our tick season has started earlier than normal, and we expect a higher tick burden than normal, which is going to be an interesting summer, I think. Even before this warm winter that we had, the Lyme disease cases were increasing, and the borders of where the ticks live that carry the bacteria that cause Lyme disease, those have been expanding for many years now. So we are seeing more and more locations starting to become high incidence or more endemic than they were previously. Currently, it's still primarily located in the northeast U.S., as well as where I am in Minnesota, in the northern Midwestern states, upper Midwestern states, as well as some mid-central Atlantic states as well. But it used to, for example, it used to never come down into the Carolinas, and now we're starting to see quite a bit more Lyme disease in North Carolina, so it's certainly expanding. So to start, we'll just touch base again on what Lyme disease is. So Lyme disease is a disease that is carried or caused by the bacteria Borrelia burgdorferi. There are other bacterium that can cause Lyme disease. That's the most common one in the U.S. Here where I am in Minnesota, Wisconsin area, there is another bacteria called Borrelia mayonnae, but it's very rare. So burgdorferi is still the most common bacteria that causes Lyme disease. And that bacteria is carried by the deer tick, or the black-legged tick. Proper name is Ixodes scapularis, and that deer tick is the only tick that carries this particular bacteria. Several other different kinds of ticks, different species of ticks, can carry other tick-borne infections, but the deer tick is the only one that carries Borrelia burgdorferi, or Borrelia mayonnae for that matter. So typically, when you are seeing patients, the very classic presentation is they can come in with nonspecific symptoms, kind of in this late spring, summer, early fall timeframe. When they're out and about, it's warm outside, the ticks are out. And they come in with nonspecific symptoms, fatigue, malaise, body aches, joint aches, muscle aches, that kind of thing. They could have low-grade fever. And that classic presentation is that bullseye rash or erythema migrans. So when we think about erythema migrans, most people will think of that very classic bullseye rash, but it actually can present in a lot of different ways. It doesn't have to be a bullseye. It doesn't have to be red. On different skin tones, it can look like different colors. It can look more along the blue-purple. It may not have that central clearing. You can even see lesions that have some eschar inside. And I've seen I had a colleague who shared their pictures from their Lyme disease diagnosis with me. And that lesion almost looked like cellulitis. It was blistered all over. So it really can look like many different things. So if you're in a Lyme endemic area or a high incidence area, or if you know your patient has traveled to a high incidence area, even if it doesn't look like that typical bullseye, you always have to be thinking. um, about Lyme disease. If you don't think about it, then we'll never diagnose it. So that is the early presentation. For those individuals who don't get treated during that early presentation, some of them may go on to develop disseminated disease, which could be CNS disease, so they could have meningitis, facial palsies. They can have radiculitis, which is most commonly an adult presentation. It's very uncommon for children to present with a radiculitis. They can have carditis or arthritis, which is the most common way that children present with a late Lyme disease diagnosis. And treatment, the mainstay of treatment really is still doxycycline, even for children. There are always lots of questions about like how do we use doxy in kids, and that has changed over the past decade. We certainly can use doxy in kids. There is based on their age, you don't want to use it for too long, but really the treatment for Lyme disease remains mainstay is doxycycline. There are other medications that can be used depending on the presentation of Lyme disease, and the duration depends on what their presentation is. So if they're presenting with early, that's a different duration than if they're presenting with Lyme arthritis. There are some great resources. For example, there's some multidisciplinary guidelines from the Infectious Disease Society of America, Rheumatology Association, they and AHA, they have all collaborated on a set of guidelines that just came out in 2021. And they have great graphs on exactly what you're seeing, what antibiotics you can use, what's the dosing, what is the duration. So I'd recommend looking at those if you have any questions about duration, medications, etc. There is also a prophylactic dose that can be used when patients have a high-risk tick bite. So high risk means that they are in an endemic area or have been to an endemic area or high incidence area. The tick was in their skin, embedded in the skin for 24 to 48 hours, or 24 to 36 hours, I should say. And it has been removed within the last 72 hours. So those are kind of the big three, I would say. The other caveat is, if it's knowing if it's a black-legged tick, and sometimes that can be really difficult for people because they can be so tiny. So I have a higher priority on the first three that I mentioned, and if you can identify the tick, great, but if not, still would consider prophylaxis. The prophylaxis is only a single dose of doxycycline, so very safe for any age, and it has an absolute, in someone who has a high-risk tick bite and takes a prophylactic dose, the absolute risk of developing erythema migrans after that prophylactic dose is less than 1%. So it's very effective. So would recommend, talking with your patients about that, even preventatively when you're doing your anticipatory guidance, letting them know that exists, because sometimes people don't know that you can get a prophylactic dose. The other thing about, when we're thinking about Lyme disease, excuse me, and tick-borne mosquito season, in talking to patients in your anticipatory guidance about how to prevent not just Lyme disease, but all tick bites and mosquito bites, because there are many other diseases that can be shared by these arthropods. So talking about DEET, and DEET is not the only one that we know is effective. So DEET 10 to 30% is great. You don't really need much more than that for kids. It's effective for 5 to 6 hours. You can also use picaridin 10%, which is, again, very safe for kids. And it's effective for 3 to 4 hours, something like that. There's also oil of lemon eucalyptus, which is different than a lemon or eucalyptus essential oil. So don't let them get those two confused. But you can buy, commercial products that have all of these ingredients readily available. So that might be a good option for patients who may be a little bit more nervous about using DEET because they've heard things from family or friends. But we do know that DEET is very safe. We just want to make sure we use it on the skin and nothing that the kids are chewing on. The other thing that families could use is a medication called permethrin, but this is not for skin. It is to treat your gear and your clothing, that kind of thing. And what's great about permethrin is you can buy it pretty much anywhere. You can get it at Amazon, Walmart, REI. And you treat the items, and then it's good for multiple washes. So if you're treating yourself, it's good for either 6 washes or 6 weeks. There are some commercially treated products that are good for up to 70 washes. So that's also a great option for boots and backpacks and tents and that kind of thing, if you're talking to your patients about how to prevent these tick bites. Also, when they're coming in from, especially for little kids, because these ticks can be so small and it can be so hard to check, especially in darker skin or darker hair, to check their hair and hairline. So just putting them in the shower or the bath, within 2 hours of coming inside can help wash away any ticks that haven't attached yet. And then putting their clothes or anything that they were wearing into the tumble dry on high heat for 10 minutes will kill any ticks that might be on there. So thinking about those things as well. And then pets too, because pets are a huge risk when they're coming in and indoors and outdoors. They can bring ticks inside, and there are several different things that you can get to treat pets. And there's actually a Lyme vaccine for dogs, so not a Lyme vaccine for humans, but a Lyme vaccine for dogs. There is a Lyme vaccine for humans that is currently in phase 3 trials, as well as a monoclonal antibody. So it'll be interesting to see what comes with those in the next year or so. What else do we have today? I think those are really the big things I wanted to mention. One of the other things that I just wanted to touch base on is, if you have not checked out our website that we created with NapNap, it's called napnapknowslyme.org. It is an awesome resource for both patients and their families and providers. It goes through all of the evidence-based recommendations. That way you can kind of quickly see, if you don't have time to go through the whole guidelines, which none of us ever do. When we're sitting in front of a patient, you can quickly go into that website and find what you need to find. And then if you want some resources for families and kiddos, there's actually resources in there for all of them, including, for example, a video on how to take off ticks, and a little comic for kids so that they can learn how to think about ticks themselves. There's a little word find. So there's all sorts of stuff that you can find in there for both providers and patients and families. We also have many hours of CE credits linked on there as well, to give you a little bit more in-depth information on Lyme disease and the different presentations that exist, and how to diagnose and treat those presentations. The only other thing I wanted to mention too is, you can't really get through a Lyme disease talk without talking about the what is the word? Can't think of the word, but we see it all the time in the news media that people are being diagnosed with chronic Lyme disease. And that gets really difficult from our standpoint, kind of the general medical community, just because there isn't a good definition of what chronic Lyme disease is. So what ends up happening is many people are using that diagnosis as more of a catch-all, or even if they're not meaning to use it like that, it's unclear what that diagnosis really means because it doesn't have a medical definition as of yet. I mean, we know that people can, up to 20% of people can go on to have symptoms after they're appropriately treated for Lyme disease. And if we look at like long COVID, which we're pretty familiar with at this point, we can see that even if you don't have an infection, you can continue to have some kind of immune or inflammatory response to that infection after the infection is gone or treated. What we do know is that prolonged antibiotic use, for months to years, beyond what we are currently recommending, does not seem to, help those outcomes in any way. So that is certainly not recommended. But we really just need more information on what exactly people are feeling as they are kind of coming through the Lyme disease treatment and symptoms afterwards, and helping them control their symptoms while not getting too anchored to the diagnosis of Lyme disease, and keeping that mind open for other diagnoses that may exist as well. I think those are the big things today. I don't know if anyone has any questions, but I'll wait on here for about a minute, and I would love to answer any questions that you have for me. And if you are not on live, but you watch this later and have questions, I'm happy to put my email address in the comments here, and then if anyone comments on the live video on Facebook, then they will know to get the question to me. So I'm happy to answer anything that comes up. Oh, while we're waiting too, I do want to mention that I have this here because I wanted to show it. But we on napnapknowslyme.org, we have our handouts that we've created for nurse practitioners available. So in the past few years, NapNap has really been trying to work on understanding where PNPs are with their knowledge and education around Lyme disease, and create educational materials to help both providers and families with kind of figuring out the tricky parts of Lyme disease. So I have here one of our pocket guides. This is our original iteration. There are 2 iterations now. They're both on the website. You can download them for free. We are, if you were at NapNap, you probably received this in your bag. If you're going to be at AANP conference this year, we will have a booth in the exhibit hall, so we'll be passing these out along with our tear pads for patient education. But this goes through kind of the initial Lyme disease diagnosis. We've got maps on here, how to remove a tick, all sorts of good stuff for patients and families as well as providers. The new one is the updated one is really provider focused, and we kind of separated that patient piece. So you can get those for free on our website. If you would like to print that out, you're welcome to. All right. Well, I'm going to sign off. Please feel free to leave any questions here that you may have after the live. And thank you so much. And happy Lyme Disease Awareness Month. And I hope you have an uneventful and relaxing summer. Have a good one.